Good afternoon, everybody. All right, so I'm welcoming everybody seated here officially to the most interesting part of this program, which is the panel session. Before I invite, or should I say introduce the guests who will be giving us great insights today, it's important that everybody should pay very rapt attention to this particular part. Please listen attentively. If you are sitting beside somebody that is distracting you, tell them to leave you alone. If somebody is sleeping beside you, wake them up. You shouldn't miss, should I even say, a word out of everything you're going to say today. So tell your neighbor, listen. All right, so for the panel session today, for the first panelist, is no other person than Dr. Olufolakemi Cole Adeife. She is a consultant physician and dermatovenerologist at Lagos State University Teaching Hospital and a lecturer of the Lagos State University College of Medicine. She is a member of the West African College of Physicians and a fellow of the National Postgraduate Medical College of Nigeria. She is also a consultant of internal medicine and dermatology. She has a diploma in tropical medicine and hygiene from London School of Hygiene and Tropical Medicine. And on top of that, she has a master's in public health and health promotion from Brunel University of London. Now, Dr. Folake is a member of the Nigerian Association of Dermatologists, the African Society of Dermatology and Venerology, the European Association of Dermatology and Venerology, and the International Society of Dermatology. She was awarded the 2024 La Roche-Posay International Research Grant for the African region for her research on albinism in Nigeria. She was also awarded the 2025 Young Dermatologist International Achievement Award for the African region by ILDS for her contributions to advancing skin health in Africa. So once again, a round of applause for Dr. Oluwafolakemi Cole Adeife as she comes to the stage. Keep clapping now. If people are too cold, keep clapping, keep clapping. Keep clapping, keep clapping, keep clapping.
Professor John Imaralu is a professor at the Babcock University and an honorary consultant obstetrician and gynecologist at Babcock University Teaching Hospital, Ogun State, Nigeria. As pioneer head of departments, that means he was the first to ever do it. He coordinated the development of framework regulations and guidelines for professional and academic training of resident doctors and medical students, activities which have contributed to the success of the institution in obtaining full accreditation status from all relevant regulatory bodies. His work entails provision of leadership for the department, mentorship, academic and clinical, especially surgical, preceptorship to trainees, specialists in gynecologic surgery, fertility, and minimal access surgery where he specializes. His trainees have continually performed brilliantly in postgraduate examinations. He was in the forefront of the establishment of the endoscopic surgical unit here at Babcock University Teaching Hospital in 2016, where advanced level operative and diagnostic procedures are now frequently done. Like I said, once again, the first to ever do it. He has authored about 60 scholarly publications in peer-reviewed journals and books, many of which have gynecologic surgery as the theme. He also continuously contributes to scientific publications as an editor and also a reviewer for several high-impact journals. So please, with a lovely round of applause, let us welcome our very own Professor John Imaralu. Please keep it coming, oh. You will meet him in O&G, oh. Please. Thank you so much, sir.
All right, next up is no other person than Dr. Olalekan Ezekiel. He is the chief consultant of nephrology at the Federal Medical Center, Owo, Nigeria. With over 20 years of experience in clinical medicine, medical leadership, research, and health administration, he has pioneered several clinical programs, including the establishment of specialized renal and infectious disease response units, and has a strong record in improving clinical outcomes and mentoring the next generation of consultants. Dr. Ojo is a leader. So Dr. Ojo's leadership extends to national postgraduate medical education, where he serves on the faculty board of internal medicine and is the assistant secretary. He's also actively involved in large-scale research as a site principal investigator for the Nigerian 100,000 Genome Project and clinical lead for a proposed Lassa fever vaccine trial at his institution. He's currently coordinating a trial in Sister Renal Center, which involves the Federal Medical Center or Obafemi Awolowo University Teaching Hospital in Ile-Ife and the University of Virginia, United States of America. So once again, give a round of applause to Dr. Olalekan Ojo.
Please keep the applause coming, oh. Do you people have over 20 years of experience in internal medicine? I don't think so. Thank you. All right, now we're going to move on to the next panelist on our itinerary, Dr. Omotayo Abimbola Ojo. Dr. Omotayo Ojo attended the College of Medicine in the University of Lagos, where he graduated. He trained both locally and internationally and obtained multiple degrees, as well as a fellowship of West African College of Surgeons in neurosurgery. Mr. Ojo did various fellowships and trainings in different parts of the world under notable and excellent neurosurgeons. He did fellowships in neuro-oncology at Royal Melbourne Hospital in Australia, complex spine at Newcastle General Hospital in the United Kingdom. He's also now a WFNS Adult Fellow in microneurosurgery, vascular and skull base in Germany. His area of interest includes complex spine surgery, microneurosurgery and neurovascular surgery, epilepsy surgery, transsphenoidal surgery for pituitary tumors, and skull-based tumor surgery. He's the convener of Lagos neurosurgery course, which runs yearly to train neurosurgeons and improve the outcome of neurosurgery in the region. He's also a national faculty of AO Spine in West Africa. Dr. Omotayo is the immediate past Secretary General of Nigerian Academy of Neurological Surgeons and the immediate past President of the Nigerian Spine Society. He's an associate professor of neurosurgery and an honorary consultant neurosurgeon at the Lagos State University Teaching Hospital. He's also the immediate past head of neurosurgery at the Lagos State University Teaching Hospital. In 2013, he won the Young Neurosurgeon Award of World Federation of Neurological Surgeons. So when we think neurosurgery, spine surgery, this is a man that has distinguished himself across 4 continents. 4 continents, Africa, America, the United States, and Europe. So please, let us introduce Dr. Omotayo Ojo. Thank you so much, sir, for being here.
And for the last panelist of today, Dr. Olajide Olushola Samuel. And let me tell you some things you don't know about him. He is a dedicated ophthalmologist and hospital administrator, a fellow of the National Postgraduate Medical College of Nigeria. His professional journey has been shaped by a passion for preserving sites and improving healthcare systems for better patient outcomes. And this passion led him to specialize in ophthalmology, where he is committed to diagnosing, treating, and preventing diseases of the eye. Over the years, he has had the privilege of restoring sight, alleviating pain, and giving hope to patients, both in the hospital and community medical outreaches. He is keen about imparting his knowledge, and this reflects in the way he teaches medical students and trains ophthalmology residents. Beyond clinical practice, he embraced leadership responsibilities in healthcare management. Currently, he serves as the Director of Clinical Services and Training at Babcock University Teaching Hospital, a role that allows him to combine medical expertise with administrative leadership In this capacity, he oversees clinical operations, ensures quality patient care, coordinates multidisciplinary teams, and contributes to policy development aimed at improving healthcare delivery. His professional philosophy is anchored on excellence, integrity, compassion, servant leadership, and continuous improvements. Please put your hands together as I bring to the stage Dr. Olushola Olajide.
He also serves as the Babcock University Association of Medical Students official sponsor. So you guys, this is our sponsor, just so you know. So please give him a resounding round of applause.
So like I said earlier, this is the most important session of today. I'm not saying every other thing is not important. It is very important, but it is very important also you pay rapt attention to everything today. We'll be addressing a lot of questions, a lot of your concerns, so please sit back, relax, and enjoy what we have for you this afternoon. So once again, to our panelists, let me start by saying thank you very much for honoring our invitation. And thank you very much also for deciding to share your beautiful insights with us. So I'll be asking the first question to Dr. Omotayo Ojo. Now, many doctors are leaving Nigeria today, but you made the decision to return and build here. And the question is, what opportunities does training in Nigeria give young doctors that they might not get abroad? Okay. I said, what opportunities does training in Nigeria give young doctors that they might never get abroad?
Thank you very much. Let me start from I'm particularly excited. I came early to a number of presentations. That tells me that the future is great. I'm particularly happy with what I saw, and I must congratulate you. So please keep it up so that I won't waste time. The question is, what opportunities will training give you in Nigeria that you won't get abroad? The short answer is none. And each time I engage my medical students, including people that I am training in neurosurgery at the Lagos University Teaching Hospital, not the sister hospital, apologies. I tell them, if you can, please go. And if you have to go, please go early. Do you get my point? If you are in surgical specialty, I honestly do not think that there's anything you may get here that you can't get abroad. But having said that, there are some specialties that if you suddenly find yourself in England, you may struggle to get into. But if you have done some of your training here and you have some certification, you may be able to continue when you get there. For instance, if you want to do neurosurgery and you go all out to get neurosurgery in England, you may struggle a little bit. But if you're already a neurosurgeon in Nigeria, by training or you've gone far, you may be able to get a placement there. And so also in many other specialties. So it's not all gloomy, but I think I've answered your question.
Okay, so our next question is to our very own Professor John Imaralu. Sir, so over the years, I mean, when we're reading your bio, one thing we had mentioned is that you were part of the pioneer people that created this college that we are now enjoying and being part of. So, sir, during this time, you have examined many medical students in examination settings, right? So, sir, what is one skill that you think today's medical graduates are lacking, right? And how can we as students start improving on it now? So what is a skill that you think medical students these days are lacking, right? And how we can start improving on that skill?
Thank you very much. Congratulations on the quality of your conference. To know that these medical students are organizing this is really, really encouraging. And I want to congratulate you all and say well done. Now, our medical students today are a lot more exposed than we were in our time. You know, what you have at your disposal here now in this day is a lot, much more, with the use of the internet and, you know, options for you to learn. Learning modules have changed. You can see a lot. You can do a lot now than we did in our time. However, a few things are lacking. I said you've seen a lot, right? But you're not doing as much as you are seeing. I don't know if you get what I'm trying to say. You need much more hands-on. And I understand the challenges we have here, technical challenges, ability to import the things we need to expose you, patient load, and so on. It's a big challenge here, peculiar to Babcock and a few institutions, you know. And let me just give an example from the obstetric side. Over 2/3 of deliveries in this country happen outside a health institution. And that is a big challenge for the medical students, for you to have hands-on. And that is one thing we need to actually improve on, to work on. I think, in summary, what I would say is that you are seeing more than you are doing. I wish you had the opportunity to actually do more, do as much as you are seeing. You'll probably be much better. Thank you.
Thank you very much, Professor Imaralu. So like he said his wish for every medical student seated here is that we get to do more. So every opportunity you get as medical students to, do anything, no matter how little it is, so far it's hands-on, conferences like this, get yourself involved in it. It's important because medicine is apprenticeship. You learn by doing, not learn by reading and reading and reading. Most of the things you do, oh yes, you can learn by reading, but doing will make it stick better, according to Professor John Imaralu. Thank you very much, sir. So now, for the next question for today is directed to Dr. Folakemi. So, Ma, you successfully won a major international grant to improve the lives of people with albinism in Nigeria. And the question to you today is, how can young doctors learn to attract global funding and partnerships to solve local healthcare problems?
Okay, thank you very much for the question. I think the first thing is to have a niche, have something that you're engaged in regularly and something you're passionate about, something you're knowledgeable about as well, and probably have had some clinical experience either as volunteering or, having a mentor and in the workplace.
International institutions. So what do you think young Nigerian researchers should do if they want to build meaningful global collaborations just like you have?
Thank you very much for that question, and I want to join other participants on this panel in sincerely congratulating you. Because like Dr. Ojo said, when I came in and I saw the quality of the abstracts and everything, I said, wow, these are not residents, these are not consultants, medical students. Because I had to just reminisce and look back at how things were during our own days. It was not like this. And I want to say kudos, you have really tried. Thank you. Now, talking about international collaboration, maybe I should take a cue from what Dr. Ojo said and then get you to know something. Quite a number of things that we are doing are literally imported, if I'm allowed to use that word. So you have this prescription for this entity, and somebody will tell you that this works more in blacks. And in different fora, the question is asked, who are the blacks that you are referring to? African Americans are not the same as Nigerians in Nigeria. So, since we have chosen to stay back in Nigeria, then we decided that, look, if you are going to say anything for blacks, and Nigeria have the largest population of blacks come to Nigeria, and if you are coming to Nigeria, you meet us in Nigeria. You know, we have Ninos. You know, there are different terminologies. Who are Ninos? Nigerians in name only. No, that is not what we're talking about. We're talking about Nigerians resident in Nigeria. So if you have made up your mind that you are going to be in this country, then of course you want to add value to yourself. Whatever is happening out there, you want them to come over, and then you tell them that, look, I'm here. I will get to the population. We might not have the data for now, though we are really working hard at ensuring that we have the data, because like Dr. Adefe said, you should be able to tell them, this is the percentage of my patients with acute kidney injury, how many of them are related to obstetrics, how many are due to toxic nephropathy, how many are due to Lassa fever, like where I'm coming from, and everything like that, on and on like that. So if you're able to tell them, look, I'm here, I'm interested in research, I will get to the population, and definitely you have a way of making yourself internationally relevant. Because one of the things I've seen is that
start learning about management early in their career. So I didn't know I was going to get into management too. Let me first disclose that. So I also did not get the opportunity to learn about it while I was in medical school. The truth is, medical doctors truly make bad managers. And I'll tell you why I said it. The truth is that because in medical school, nobody prepares for management, Abi? Yes, nobody does that. And so we learn all the physiology, anatomy. Nobody does that. And so we learn all the physiology, anatomy, biochemistry in preclinicals, and then learn all the pathology, pharmacology, and then medicine, surgery, O&G pediatrics, and then medicine, surgery, O&G pediatrics, and what have you. And yet we are expected to be the leader of the EarthTeam. But nobody prepares us for and something we
thank you for that. Thank you for that. How can we turn the limitation? How can we turn the limitation to an advantage? Especially in surgery. One advantage that we have is the population. And fanciful gadgets, but he will pick the skills, then he can continue from there. So basically, the volume is an advantage.
Thank you very much, sir. So like he said, there is serious strengths in our numbers. The fact that we have a very wide and massive population means that it's also an advantage. Nigeria is the only country where you find out that you get exposed to a lot of hands-on very, very early in your career. Over there abroad, you can't find them even say house officer doing some level of surgeries. If you try it. But you find over here in some institutions, house officers are doing cesarean sections. And if you imagine doing that as house job level, imagine yourself 5-10 years from then, how many you would have done. So there is so much opportunity, like Professor Imaralu said, for hands-on when you leave medical school. Take good advantage of it. Learn and become the best surgeon you can ever be. Thank you very much, sir. So the next question for Professor Imaralu. Now, there's something going on right now, not just in Babcock, but in a lot of universities. People are just writing research papers. But thinking about this deeply, a lot of people are writing research papers that people have written 50, 60, 100 times. I'm not saying that is bad, because at the long run, effort counts a lot. So how can medical students get involved in research that actually improves healthcare in Nigeria compared to them just writing research or publishing papers?
Thank you very much. You have touched on a very, very important aspect. Of your training. It's true. Research, we have so many people writing papers being repeated, concepts that have been, touched on before are being repeated, over and over again. Research should be for development. And that is one thing we hammer on people. It should go beyond writing papers for promotion. You should go beyond just writing papers to pass exams for medical students. I just want to pass and go. You finish and you drop it. It is not influencing clinical practice. It's not influencing policy change. If we have the desired effect, a lot of those duplicated research would not keep going round and round like a circle over and over again. That is duplication and wastage of resources. I'm happy you guys are able to identify this at this level in your career. I'm looking at the future. My heart is boiling. My left ventricle is beating fast with joy that our future is secure for you to touch this. Now, you have identified the problem. How do you approach this? That's your question. Now, you have started the right footing. This conference is part of your answer. You have already started right. You are going to make, at the end, sometimes we usually have what we call, at the end of a conference, you have, what's that thing they call it? You have a statement, a communique given out. And I'm sure even if people don't do anything about it, it will be in the hearts of some people, we plan to make this change. We plan to do this. When you want to do your final year project next time, your thinking will change. How you conceptualize your research will also change, right? Now, that is one answer. The other is mentorship. I've done I've done a lot of my writings, I've done with residents, I've done with medical students, right? Sometimes medical students conceptualize this project. They come to us, we fine-tune for them, and we teach them the methods, and we throw them into the field, and we write together. That kind of research is owned, co-owned by the students. We don't want, put me there, write my name there kind of research, authorship. We don't want that. We want you to be involved from the scratch. I feel just recently some students have come to me with their own ideas, and they look novel. All I need to do is just, fine tune for them. And the little, I even sampled some of them. I realized they have some skill from your community medicine, just to hone their skill and put them in the right direction. You guys will do wonders. That's what I've seen. And you're on the right track. Mentorship. And your training too. What you have learned in community medicine, a lot of it is supposed to help to stimulate your thinking, to help you conceptualize issues. And one thing I try not to do, one of our respected guests have mentioned it, we don't want you to work in silos. We want you to be exposed. I'm happy for the exposure you have. You'll be able to identify issues. When I teach in class, some of my objective is to get you guys angry. You see the problem. I lay the problem before you. Maternal mortality. Nigeria is captain of the men of death when it comes to maternal mortality. It's the most dangerous country to give birth in today. I want you guys to, we try to stimulate you, get you angry, you start thinking, how do I solve? So when you come to the next lecture, you listen, where does this fall in? You begin to fit in all of those things. And we said it's conferences, mentorship, and the content of your classes, the curriculum, the content of your curriculum. They are geared to make you find solution. We're bringing you into why do we do our fellowships? We bring you as fellows and members to help identify and co-solution finders to these issues that we raise. And that is where our research should be directed. In summary, research should be geared toward what? Development, not just writing. So, ladies and gentlemen, thank you.
That was very insightful. So like he said, the key takeaway is involving yourselves in conversations and in spaces that can actually stimulate you and prompt you to think, which is what he does try to achieve with his lectures, and I'm a direct beneficiary of that, so I know, particularly in preeclampsia class. So he brings up these conversations, he brings up these spaces for us to express ourselves, and then when you have these advantages, when you have these spaces, you attend conferences, you make use of your resources from classes. By the grace of God, we're privileged to be here. So all of these things are not things that we should use in isolation, but rather in collaboration. And then when we put all of these things together, prompting and thinking of beautiful, innovative ideas would not be something that's difficult. And another thing is also having mentors as well, because you can have a thought, but it's much better when someone that has walked that same path that you're trying to go directs you and navigates your thoughts. So you can bring up something that you think, oh, this is cool. It will be even much better if you take it to somebody that has walked that path so that they can fine-tune that, and then you would have a better outcome. Thank you so much, sir. All right, so the next question is to Dr. Folakemi. Ma'am, so a lot of people, me as well, right, we share the sentiment of wanting to make impacts. Not just impacts locally, nationally, but even going as far as being global. Some of us want to work on WHO stages, United Nations stages, and things of the sort. So what practical step do you think we as medical students can take if we want to become more involved in advocacy, policy, and global health work? What do you think we can do as med students to kind of kickstart that?
Okay, I would say first it's having a genuine desire to make changes and looking at some of the things in your immediate environment that, need a lot more work. Volunteering is also very important. Volunteering with local NGOs, civil society organizations, volunteering with international organizations is also very helpful. And then the world is a global village today with the internet, with social media, and rather than using social media for negative purposes, you can use it to interact with colleagues from across the world. So join groups and networks of medical students across the world that work in an area that you have interest in. For instance, someone made a presentation which I was very impressed with about green, the impact of planetary change and the green revolution, so to speak. So if you could look for like minds in that area who have interests in that area, connect with them across the world, do joint campaigns, which is something I have been involved with. The WHO has a network of health professionals on social media called FIDES, and from time to time we do joint videos together from India, from from Chile, from North America, and you can also speak in your local languages so that you put...
People seated here have complained tens of thousands of times that Babcock is hot. Have you ever asked yourself why? So everybody seated here today, this is a challenge to you. You need to start caring enough. You're saying there are no problems to solve again. There are no new research papers to write. There are always problems to solve. You just haven't cared enough. If one person says something, it might be a lie, but everybody seated here today has been saying the same thing. Prof. Shotusa came here this morning and said what? Stand on shoulders of what? Giants. You can't do this world alone. Everybody needs to realize that. Collaborate with your friends, collaborate with people who are higher than you so they can help you. Because why? You can't do it alone. Thank you very much, ma, once again. So the next question is directed to Dr. Ojo. Now, he said you have collaborated with international institutions. What should young Nigerian researchers do if they want to build meaningful global collaborations?
Thank you very much for that question. What should Nigerian doctors do to build meaningful global collaborations? The first thing I would say is that you cannot sit in your cocoon and expect that people would know you. This is Buams, I think, Babcock University Medical Association. We should start from there. Belong to an association like this. When you graduate as a medical doctor, you should have your professional association in addition to the others. And then invest in yourself. When we say invest in yourself, we're not talking about getting iPhone 17 Pro Max. Invest in that thing because, I mean, look at everybody here, different specialties. As we also have, I mean, even among some of our senior colleagues in the audience. Before you go global, let's start from the local. As a nephrologist, I became a senior registrar 22 years ago, and that year I joined the Nigerian Association of Nephrology. And I've been there. I was secretary till about 4 weeks ago. I mean, for 4 years. And then I started attending international conferences about 15 years ago. No, 2009. That was some years ago. And one of my mentors, because there are some things that we need to say clearly. You cannot do it alone. You cannot do it by yourself. And if you choose to do it by yourself, it's going to take you much longer to attain. One of my teachers told me, Dr. Joe, when you are going for conferences, 2 things. Endeavor to make a presentation. 2, make a new friend. And when you are making friends up, you understand what so 2009, I was at the African Regional Association of Meeting of Nephrology. And then I saw somebody, one from Colorado, the other one from Connecticut, Yale. And after the meeting, I walked up to greet the 2 of them, and somehow I liked the guy in Yale more. So we started interacting. He invited me over, and then ISPD funded the training in 2010. And at the end of the training, and when I got there, I knew what I wanted. And when I was rounding up, I didn't know he was observing. He just said, Doctor, you have trained a number of fellows, and I really like you. Would you like to stay back in the US? I said, no, I'm not interested in the US. I'm going back. And the first thing that happened was that anytime there is an offer, that involves Africa, he will call me. Dr. Joe, are you interested? I learned something is going on in Ghana. Can we meet? So we met in Ghana, another meeting in Senegal, and on like that. So we had that relationship. 2011, I was invited to Italy and everything like that. And since 2011, I've not missed any World Congress of Nephrology. I think next week we're going to Japan. And each of those places, I will have my only 2 presentations to make. People will ask questions. Why are you doing this? We have limitations. You have everything. Can you invite me over such that I can learn more and everything? So you should, like I said, invest in yourself, attend meetings that are relevant to what you are interested in. Look at the main people in that world. For instance, you cannot be talking about urinalysis in the world and not talk about Fugazi. I met him maybe 2009 or 2008. Fugazi, please, so I went to Milan in Italy. In fact, that's where I spent my Christmas in 2011 and everything like. And I asked him, how come that this is your area of all nephrology? He said, Dr. Joe, everybody seems to have cornered everything. I decided to stay in the urine. And when you get to the laboratory of this man, in fact, I've forgotten the name of that company. They were using his lab to validate the machine that will now be used in doing all of this analysis and everything like that. So, invest in yourself. You want to be a neurosurgeon. Don't start from Austria. Dr. Tayo Joe is there. Somebody has his contact. Show interest. He might not be able to respond immediately. Keep on disturbing him. How can I remember there used to be Dr. Sanusi here, the vascular surgeon. I've not met him in person. But when I needed AV fistula to be created, and we've spoken more virtually than in real life. So if he says somebody is his friend, Dr. Joe is my friend, that's how we met. So want to do anything AV fistula, you will remember Dr. Joe is somewhere. So stay in that area of influence, and if you see something going on in that area, be there, speak, express your limitation, show the interest in wanting to improve, and then, of course, you relate with your mentors, and then you enter into the pool at some time. Thank you very much.
So what I believe the important takeaway is, if you want to build global connections, right, you're going to have to invest in yourself. And investing in yourself means joining societies, particular to what you want to do. So building yourself within that niche, and also applying yourselves when you go to certain places. So you're going to a conference, apply yourself, present an abstract, meet people. These spaces are spaces to not just show what you are capable of, but to also meet people of like minds that can continue to stimulate you to do more, and not just stimulate you, but they can also refer you. Like, the power of referrals goes a long, long way. And how do you get those referrals? It's by appropriate and adequate networking, which you can do. Through Buams now, we're over 800. There's literally 800 people for you to network with. That is 800 opportunities already. So you go to a conference now, for example, you meet another, even if it's 2 people, those 2 people will take you to 4 people, 4 to 6, 6 to 8, and eventually you're conquering the world. So when you have opportunities like this, take them head on, apply yourself, invest in yourself, and keep growing in that thing it is that you want to do. And eventually, tiny drops will make a large ocean. So thank you so much, sir, for that insights. So our next question is to our very own Dr. Olajide, our sponsor. Sir, medicine oftentimes can be exhausting. I think that is something that is unique to it. Everywhere in the world, regardless of where you are, with the most technological advancements to the least, medicine will exhaust you. So we also live in a country where the system...
Once he has the seizure, we'll take him to, my parents will take him to the hospital. And I was this very night, in the middle of the night, about 2 a.m., he developed seizure again. And at that time, my parents were not mobile. They could not take him to the general hospital where they used to take him, which is about 20 minutes drive from our home. And so they took him to the nearest hospital to our house. And then the brother never had seizure again till today that we speak. And so about 4 or 5 months down the line, my mom met that young doctor was not married at that time, by the roadside. You know, we were waiting to take a taxi. My mom saw that young doctor by the roadside, and my mom went on her 2 knees by the roadside to show her appreciation to that doctor. And that day, I was still in primary school, and that day, I decided I was going to become a doctor. And so you see that it's easy for me to be motivated and to show compassion. And so I'm saying that, yes, the pay may not be enough to motivate us. The working conditions may not be enough at times to motivate us. But truly, if you are in medicine because you want to save lives, then nothing, and absolutely nothing, would prevent you from doing what you need to do to help others. And probably you have found yourself in medicine for one reason or the other. Then now, let me now add this. One, remember that you are dealing with people's life. Before I came a bit late. I was there before, and then I went back to my office. And then I saw a patient relative that needed to see me. And the man said while his father was on admission, he developed bed sores. And this elderly man, older than me, broke down crying. He said he could not bear to see his father, with that sores. And so remember that those people that you are seeing or that you will end up seeing, they are people's relatives. They are people that love them. They have people that feel the pain. In fact, that man said, "Doctor, please do everything. I cannot afford to lose my father." Let's remember that they have loved ones. Let's remember that people care for them. And let's put ourselves in their shoe. And so ask yourself, if this were to be my father, if this were to be my mother, if this were to be my brother or my sister or my child, I think that in itself is enough motivation for us. And so what am I preaching? Empathy. Let's put ourselves in our patient's shoes. And that should motivate us enough to be able to go the extra length to help this patient.
Thank you very much, sir. Just to add to what he said and give a very brief recap once again. One of the richest men to ever, should I say, live in America said something. He said the highest reward for your hard work is not what you get, but what you would become. It's high time as medical students and as people of purpose, we stop seeing work as punishment. Learn to love your work. For God so did what? Loved the world, that he did what? Gave his only begotten son. When you love what you do so much, you can do anything to make it happen. The reason why Nigeria is not where it is today is because we don't love our country. So the message from him today, passion will get you through medical school. But aside that, in between the hardship of medical school, love your work, love medicine, and love your patients. Thank you very much, sir. All right, so to call this panel session, or should I say bring it to an end, we'll be taking 3 questions from the crowd. 1 from each, should I say, column. So if you have any questions you want to ask, please put up your hands. Just 3 questions from this side, A, B, C. 1, any other person with questions? From this side, anybody? 2, please be coming forward as I'm picking you. From that last side, come forward. Last person from that side. Last person, okay, girl in pink at the back, let's come forward. Person on pink at the last person here. So is anybody in front? Sorry.
So my question is basically about time management in medical school. Oh, I think it's general, because it's a general question. So it's a general question. My question is about like time management in medical school, especially when you have exams back to back to back and you have to focus on your studies. How can you balance that with, wanting to do things like research and other stuff like that? Thank you.
All right, thank you very much. Next question.
Good evening, everyone. I'm Emmanuel Ezemaduka, 200 level medical student. So my question is to Dr. Uju and the dermatologist. I've forgotten your name, I'm sorry. So I understand your perspective regarding the
how rotations is still the same thing, like there's little to no change. So how do we address the fundamental gaps in practice, like not just theoretically? How do we address the fundamental gaps as future healthcare professionals? What can we do practically to make sure that our healthcare system is better? And I think my third question is, we always say that we can make a change, we should try where we are and everything. But I was having a conversation with someone a few days ago that how do we as individuals make that global change? Because there are many people that want to make a change. So how do we make a change that indeed is a change to other people? I don't know if my question makes sense. Thank you very much.
Thank you. Good day, panelists. My question is to Dr. Deife. What advice would you give an aspiring dermatologist? Thank you. That's
All right, thank you very much for all your questions. So people asked about balance. People attack the healthcare system in Nigeria. People asked about balance. People attack the healthcare system in Nigeria, saying, yes, comparing it to the healthcare system abroad, how can you, should I say, take full advantage of those opportunities? We talk about extracurricular activities in medical school. How do you juxtapose and make sure you don't allow any part of your life suffer? And people ask, or somebody asked, a very special question to Dr. Adeife. What's your special word of encouragement? What message do you have for an aspiring dermatologist? Thank you very much. We'll start from Dr. Adeife.
Okay, sorry, I was just trying to write down the question so I don't forget. I think two questions. Thank you very much for the very intelligent and thought-provoking questions. I think the first one, someone mentioned talking about the advantages of training here. And yes, in dermatology, there are a lot of advantages. We tend to have the best of both worlds because we use a lot of textbooks that are representative of lighter skin tones, white skin when we're talking about dermatology. And then we also see the same conditions in darker skin, in our black skin, which a lot of people in the world are struggling with and have realized that they are deficient in, particularly in training. And so this presents a very unique opportunity for us in dermatology to be able to teach the world a lot more about the presentations of skin conditions in darker skin types. And it's helpful because you find that a lot of people around the world are interested in learning from us, in inviting us for conferences to also collaborate on research, to be able to showcase, okay, this is what atopic dermatitis looks like in African skin with our climate. This is what psoriasis looks like. This is, what things like urticaria, and it really is an advantage, I would say, because if you are here in Nigeria, as other panelists have also mentioned, the largest black nation in the world, we have the numbers and we'll be able to, if we are dedicated to our research, we'll be able to make an impact on the global stage, particularly in things that are peculiar to Africans, darker skinned people. And so that is quite an advantage, I would say, on our own part as dermatology. The other questions on, I just say, of health systems, I always say you have to get involved in politics. You cannot leave politics to politicians. Everybody's running away from politics and saying it's a dirty job, but if you don't get involved in politics, in civic society movements, then things are not going to get better, because at the end of the day, the people who have the budgets in their hands are, they need to be held accountable by those of us who are actually seeing the patients, who are working in the hospitals. And so it's very important that if this health system is going to change, there has to be investment from the political and from the governmental level. And that can only happen if people who are in medicine get involved in the politics and the budgets and the other things involved. And then the last thing about how will I guide someone in dermatology? We are always happy and welcome people who are interested in dermatology. It's a fantastic field, and we are a very close-knit community, not just in Nigeria, but globally, because there are so many opportunities in dermatology. The world is now beginning to understand the importance of skin health. And so there was recently a resolution passed by the World Health Assembly recognizing skin diseases as a global health priority. And so we have a lot of opportunities for young people who want to get into dermatology. My advice would be, look out for where we have conferences, apply to attend as students. We do give rebates. We do sponsor medical students. The last conference we had in Lagos, the Nigerian Association of Dermatologists, we sponsored over 30 students to attend the conference for free. So look out for, I think the next conference is in Benin City, and we will also have a similar program where students can, be sponsored to attend and get to meet dermatologists from all over Nigeria and across Africa, because we usually have a lot of representation from across Africa and the world. And then you can get mentors from there. You can join programs that mentor medical students in the area of skin health, volunteer for some of the advocacy work we do, and we'll be happy to have you and guide you as a dermatologist, whether you're training here or abroad. Thank you.
All right. Thank you so much, Ma. So important takeaways from what she has said. We need to start, if we want to make actual change, like you said, right, you need to start involving yourselves in the systems that spearhead these things. So that is at the political level. So we have at the federal level, the state level, we have commissions, we have bodies within the Senate that actually spearhead these policies that we think would actually make change. So for those of us that are firsthand witnessing all of these problems, it's best that us that witness the problems get involved in those spaces, because someone that has seen the problem before is the best person to speak about the problem. Because someone that hasn't gone through that system, hasn't experienced what you're experiencing, they wouldn't have the same vim and the same empathy to speak about these issues. So it's good that we're here and that we can identify these issues. But if you're really passionate about making change at a global scale, get involved in policy, get involved in politics. We have so many avenues as well as medical students to do so. We can join conferences with societies, like she said, Nigerian Society for Dermatology. We even have, as little as our Nigerian Medical Students Association, Standing Committee on Policy Implementation. All these avenues, we can join them, we can move with them, we learn about how we can directly affect policy that would eventually directly affect the world at large. So thank you so much, Ma, for that. Also, so we're running out of time, so we're just going to throw the questions to certain speakers. So Professor Imalu, you're someone, like we've mentioned, that has constantly trained medical students over the years. I mean, from Orion 1, now, 12. We even have as far as almost 15 now. So the question on time management, how best do you think we can handle so many tasks like as medical students?
I will start with interest. What is your mindset? What do you plan to achieve? If you have that at the back of your mind, then you'll be able to make a scale and, apportion, weight to what you want to do. What can I do now? What is not necessary at all? What can wait till later? So if you're able to do that, then you'll be able to manage your time very, very well, concerning your studies, concerning your career. I have one more statement to just add after answering this question. For those of you that are asking questions on, do I want to stay in this country? Do I want to go out? Almost on a weekly basis, I sign up for students who want to, graduates here, who want to, on behalf of the ECFMG, who want to go to the United States or UK. Now, there is no best place, but it depends on your interest. What do you want to make out of your medical career? Am I out to make a fortune? Or am I out to make a change? Am I out to solve a problem? Or am I out to be recognized for something? That will determine where you want to be. Whether you want to jack back, or you want to stay back, or you want to jack back and come like many of us do. We jack back and come, we go and pick the skills, and we bring it back here. And we jack back, we keep going and coming, pick new skills, and come back here. So that is that one. I'll just stop there.
Thank you very, very much, sir. So you have heard. Choose what you want to do. Do you want to jackpot and never come back? Do you want to jackpot and come back? Or do you want to stay? Thank you very, very much, sir. So now, next question to Dr. Ojo. Somebody asked a question about extracurriculars at medical school. Medical school is demanding, it is draining. And the funny thing is the schedule doesn't even encourage people to even want to do extracurricular because you're always tired. So how can we navigate that particular sector and make sure that, yes, I'm a doctor, but I was a very great footballer. I don't want to lose that skill.
Thank you very much. It would be an understatement to say that medical training, whether the undergraduate or postgraduate, is demanding. But be that as it may, you still have to be a whole person. Oftentimes, when I'm taking residents and they get flat on other things apart from the medicine, I don't really like it. You know, I want to know, sorry, what's your opinion about DOMA, about the change made by Ateta and everything? I say, is our guy able to? I say, look, you are still supposed to be a human being. And even though I've not spoken to Dr. Ojo in a long while, but if you have read the book by this person whose name, your institution is named after, Ben Carson, he did not get a residency in neurosurgery by talking about the foramina in the brain. They were talking about music, classical and everything like that. So that you're a medical doctor should not mean that the other aspects of your life should shut down. But at the same time, medicine should be given priority. I mean, as a medical student, from year 1 to year 6, I was a leader in the fellowship. I got ordained as a pastor in 2004. I'm a regional pastor today. I have a private practice. I am a fellow of a number of these associations. I was the secretary of the Nigerian Association of Nephrology, and I still do some other things. Now, the first thing I will say again is know yourself. Don't push yourself beyond your limit. When I was in medical school, from year 3 till I graduated, it doesn't matter what I had done in the day, 4 hours still will go to my study. You understand? 4 hours. So other things can, go, but the 4 hours must be met. You understand? And as a resident doctor, from year 1, I made up my mind, none of these exams would have to be written twice, except if there are circumstances beyond me. And by God's grace, you were there, Professor Maralu. One touch, you go, and everything like that. But my 4 hours was maintained. So other things will come in, but nothing is going to touch the hours meant for medicine. You understand? And even today, as a nephrologist and everything like that, I still have enough time for the practice. Try my best. Of course, my wife is the better. to see how to have time enough for the family, but you need to know yourself. You understand? Don't get carried away by those other things that you now forget your primary calling. And look at the things that can enhance your, in studying or in education, there is this Aristotelian principle of consanguinity that says that you are able to remember better when you can associate an event with another thing. So this has happened. How is it related to this thing? It helps you to remember. So, I mean, I think that is what is necessary. But you need to know yourself a lot better. Thank you.
So like he has stated, knowing yourself is very important. Knowing how far and how high you can jump is important so that you don't push yourself beyond the limit. And also planning is very important. So setting out time for those extracurriculars, like he said, don't make medicine your entirety, right? Make out time for the extracurriculars, but still always remember to prioritize that at the end of the day, you're here for a goal, and that goal is healthcare. So let us learn to plan and appropriately manage our time, because if you fail to plan, you plan to fail. So we need to be more intentional about that. So before we go on to the last question for the day, we're going to be recognizing the presence of certain important invited guests. One of them is our very own head of department for the Department of Chemical Pathology, Dr. Tunde Olayoju. Sir. We also have in our midst a pediatric cardiologist, my very own lecturer, Dr. Oyebanji. Thank you so much, sir, for gracing us with your presence. Further, we have our state epidemiologist for Ogun State, also present in our midst, Dr. Saheed Akimbowale. We also have the Chief Operations Officer for our dog, Dr. Joy. And lastly, but most certainly not least, we have Dr. Victor Okebalama, which is actually going to be spearheading one of our breakout rooms this afternoon. Thank you so much, guests. All right, so for the last question is to Dr. Uju, not Dr. Lalikon, you sir. Wonderful. So, sir, the question was regarding you going abroad. Like we mentioned during your bio, you've worked across 3 continents, Australia, Africa, and even as far as Europe, right? So what particularly made you come back? Like, some would say you didn't even need to come back. Like, there's so much opportunity out there. You've conquered the conquerors and even more to come. So why in Nigeria? Like, why did you come back here? And do you think it's important that we also come back?
Well, thank you for that. It's a question I get asked many times. So I started my training in Lagos University Teaching Hospital. And within 1 year, I felt I'd seen enough, because if you take your mind back to 2003, 2004, there was very little we were doing in the country. And fast forward 5 years later, I felt I'd seen enough, so I went to Australia. I didn't go to stay. I went to study. In youth, in those days, we used to have 1 year abroad where we get sponsored for 1 year. Of course, many will decide not to come back, and if I'd wanted to, I could have stayed back. I mean, the temptations were there, and the offers were there, but not in neurosurgery, which was kind of a deal breaker. So I made up my mind that, one, I want to demystify neurosurgery. That was my goal then. So I went to the best in Australia. The guy I worked with was the one-man majority. From there, I was doing well. Then I got a job in England, part of the training. So I went there, and I decided to specialize in micro-neurosurgery, complex spine surgery, and things that were not done in Nigeria as at that time. Well, that were not readily done then. So by the time I felt I was done, I was actually offered, but not as a consultant. So, but one day, I was a resident, my house officer is Nigerian, my chief, they called them the matron, but the head of the nursing service there is Nigerian, were handling over to another complete set of Nigerians. I was handing over to Dambata, who is a neurosurgeon now, and so on and so forth. So I felt, look, these things that we were doing so readily in England, if my father had it, he would die. If anybody close to me had it then nobody was clipping aneurysm, pituitary surgery was 50-50 mortality, and so I felt, okay, maybe I'll be more relevant if I came back. Because there, I was just like 1 in 1 million. When you do it, you just get they may not even recognize you. But as at that time, it wasn't so easy in Nigeria. So I thought, I'm not sure now if I would think the same, but I thought then that I'm better off coming back. What would be my advice? If you have to do surgery, you are asking about what would be the advantage of the peculiarities in Africa and in other places. If you have to do stuff that you will need your hand, I will encourage you to go, and if you like, come back. Because the skill set you will get when you are outside will be different from what is available now. If you look back, if many of the people that you look up to now in different specialties, if they never stepped out of Nigeria, the practice would be significantly limited. So, and you are asking what is the advantage of practicing here or training here, we tend to see the worst of cases. And by the time you have seen very big tumor, very big this, very big that, when you see small ones, you'll be able to think outside the box and your outcome will be better. It's not that I'm telling you that you don't need all those highfalutin things. Yes, you do. But the experience you get from what you do in Africa is enormous. And if you look at it this way, look at how you've been training, the stress you've been going through. If you were doing this, if you were putting the same effort to read medicine in England or in the US, I assure you, you'll be getting excellence. You'll be getting high marks because of what you've been going through. But anyway, just to answer the question, why did I come back? I felt I could make an impact. And looking back, I think I've made impact, and I think I'm still making impact. So if you are able to define your goals, and if you're able to walk through it, and God on your side, I think you can get what you want. Thank you.
Thank you very much, sir. So you've heard. Those of you that are still thinking of leaving Nigeria and never coming back, please, this is your motherland. The national anthem you've been singing in primary school, the pledge you sang this morning or recited this morning, is not for fashion. Remember your country. Don't forget Nigeria. Thank you very much, sir. So to round up this session, I'll be giving the microphone to the last panelist. So sir, please, in 1 minute, the sponsor of Buams, please, I would love you to just give us a 1 minute recap, advice, anything you have to say. Because I know you can read minds as a business administrator. Just tell us every single thing you have to say. Thank you very much, sir.
So in 1 minute, I would say, wherever you find yourself, you have an opportunity to make an impact, and do make an impact. Do not look at what you can do on the global stage. Look at the difference you can make in the life of that one person. And let me just give you as an example as an ophthalmologist within 30 seconds and I'll be done. In the advanced world, what we do now for eye surgery is phacoemulsification. But as an administrator, I know that if you buy that machine in this country and you want to offer the services to your patient, it won't come less than ₦1 million to do it. And the question is, how many people out there will be able to afford that kind of surgery? But if we do the crude method that we use that nobody uses in the advanced countries again, and that patient sees, then you have made all the difference in the life of that patient. You have impacted that patient's life. And that's the message I bring to you. Wherever you find yourself, that patient, that single patient that came in contact to you, that you have impacted that patient's life, you have made an impact in that patient's life forever. And if that's the only thing you do, then you have done enough.
Thank you very much, sir. So you people have heard every single thing, 5 times, 10 times, 1 million times. So to bring this panel session to a close, we can't let them just go like that. We'll first shout and say, thank you, sir, thank you, ma. I saw some group of boys at that back, they did not say anything. I'll remove this tie and come and drag you people. Please say it from your heart. Say, thank you, sir, thank you, ma. And the last part, say, God bless you. God bless you. All right, so to present the awards to our wonderful panelists today, I'll be bringing or calling forward one of our own, consultants, anatomic pathologists, no other person than Dr. Wadioku. Clap now. Clap. If you don't clap, you sit in your exam. Write it down. Okay, joining him on stage, I'll bring one of the biggest brains behind this program. People should be clapping now. Give it up for Samuel Olalekon. Clap, 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 clap. Keep clapping, it's not easy. To bring a neurosurgeon, a consultant nephrologist, a consultant obstetrician, it's not easy, we should clap. And lastly, this would have been possible without the support of the Buams presidents. So please put your hands together for Emmanuel Owolabi. Clap, 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 clap. So we're presenting the first award to Dr. Olufolakemi Cole Adeife. Next up on the list, our very own Professor John Imaralu. Next up, Dr. Omotayo Uju. Dr. Olushola Olajide. Okay, and last but not the least, but before I present this award to Dr. Olalekon Ojo, Please, I would like to invite Dr. Olubukola Ojo, a consultant endocrinologist, who is also the wife of Dr. Olaliko Ojo. Please put your hands together. I'm talking about families of doctors. And not only that, we're also blessed by your beautiful son, pastor, leader, Dr. Tomisin Ojo. So please don't leave the stage. Now all of us are going to take pictures together. Sorry, ma. Ma, please. Gianna Onoa. A round of applause once again as they go to their seats. Thank you very much, sirs. Thank you very much, ma, for deciding to grace us with your presence.
So the LOC has sent a message to the group chat. There was a Google form link that was sent to the group chat. So please hop onto the group chat at this moment and then make sure you fill the form. Please, the LOC sent a message to the group form and fill it. Thank you so much.
Yeah, one more thing. Please let everybody in this hall clap for Gianna. If people are not clapping well for Gianna, she's one of the main organizers and lead of this program. It is not easy. Please clap for Gianna. We'll do our normal, should I say, ritual. Say, God bless you, Gianna.
God bless you, Gianna.
And thank you, Gianna.
Thank you.
Once more, let's clap for our panelists once again as they leave this hall. Now, to bring this session to a close, we will be breaking down into 6 hubs. Hubs 1 to 6. Hub 1. So please, everybody should check the tag that they gave them. It has your hub on it.
Yes. So once again, look at your tags and you see the letter H and then a number right beside it. Similarly, as we did in the morning, there was letter A, 1, 2, 3. So check and you'd see letter H, 1 through 6. So depending on if you're H1, that's your hub, H2, H3, 4, 5, 6.
Exactly. So H1, Hub 1, H2, Hub 2. And so Hub 1, lecture room 4. That's your venue. Hub 2, lecture room 2. Hub 3, lecture room 5. Hub 4, you stay downstairs here at 600 seater. Hub 5, you're going upstairs here, 600 seater. And Hub 6, you'll be going to lecture room 6. So I'll repeat myself once again for purpose of clarity. Hub 1, lecture room 4. H2, Hub 2, lecture room 2. Hub 3, lecture room 5. Hub 4, downstairs at 600 seater. Hub 5, upstairs, 600 seater. And Hub 6, lecture room 6. If you have any difficulty locating any of these places, please reach out to any of the event hosts, planners, or ushers, volunteers. Thank you very much. You can start breaking down into the hubs.
Thank you so much for being here. And once again, we're your hosts, Ezembanasa Odoka and Amushan Bolahon. Have a good time at your breakout sessions. Thank you.